Members, please take your seats. Good morning, everyone. Good morning, everyone. This is the public hearing and public meeting of the Committee of the Whole regarding bills number 260199, 260200, 260201, 260202, 260203, 260204, 260205, 260206, 260208, 260209, and resolution number 260227. Ms. Lawhead, will you please call the roll?
Councilmember Squilla. Councilmember Gautier. Councilmember Jones. Councilmember Young. Councilmember Driscoll. Councilmember Lozada. Councilmember Bass. Councilmember Phillips. Councilmember O'Neill. Councilmember Gilmore Richardson. Councilmember Thomas. Councilmember Harity. Councilmember Ahmed. Councilmember Landau. Councilmember Brooks. Councilmember O'Rourke. Council President Johnson.
Present. Thank you, Ms. Lawhead, are present. A quorum of the committee is present, and this hearing is now called to order. Ms. Lawhead, could you please read the title of the bills and resolutions?
Bill number 260199, an ordinance adopting the operating budget for fiscal year 2027. Bill number 260200, an ordinance to adopt a fiscal year 2027 capital budget. Bill number 260201, an ordinance to adopt a capital program for the 6 fiscal years 2027 through 2032 inclusive. Bill number 260202, an ordinance amending Chapter 192400 of the Philadelphia Code entitled Hotel Room Rental Tax by providing for an additional excise tax on hotel room rentals, all under certain terms and conditions. Bill number 260203, an ordinance amending Subcode A, the Philadelphia Administrative Code of Title IV of the Philadelphia Code, the Building, Construction, and Occupancy Code, by adding and revising zoning board of adjustment fees and provisions regarding hearing scheduling, all under certain terms and conditions. Bill number 260204, an ordinance amending Title III of the Philadelphia Code entitled Air Management Code to modify the amounts of license and permit fees under certain terms and conditions. Bill number 260205, an ordinance amending Section 19-1806 of the Philadelphia Code entitled Authorization of Realty Use and Occupancy Tax to clarify the imposition of the tax on the use or occupancy of real estate with respect to cell towers, all under certain terms and conditions. Bill number 260206, an ordinance amending Chapter 600 of the Philadelphia Code Asbestos by adding and revising provisions related to various fees, all under certain terms and conditions. Bill number 260208, an ordinance amending Chapter 19-1800 of the Philadelphia Code entitled School Tax Authorization to add a new Section 19-1808 entitled Authorization of Rideshare Use Tax to authorize the Board of the School District of Philadelphia to levy a tax upon the use by a passenger of a transportation network company for a prearranged ride that originates in Philadelphia, all under certain terms and conditions. Bill number 260209, an ordinance amending Title 19 of the Philadelphia Code entitled Finance, Taxes, and Collections to add a new Chapter 194800 entitled Retail Delivery Tax to establish a tax on orders for the delivery in Philadelphia of a retail consumer and other tangible goods, all under certain terms and conditions. Bill number 260227, providing for the approval by the Council of the City of Philadelphia of a revised 5-year financial plan for the City of Philadelphia covering fiscal years 2027 through 2031, incorporating revisions with respect to fiscal year 2026, which is to be submitted by the Mayor to the Pennsylvania Intergovernmental Cooperation Authority, pursuant to an intergovernmental cooperation agreement by and between the City and the Authority.
Thank you very much, Ms. Lawhead. Today, we hold a public hearing of the Committee of the Whole to consider the bills read by the clerk that constitute proposed operating and capital spending measures for fiscal year 2027, a capital program, and a forward-looking capital plan for fiscal year 2027 through fiscal year 2032. This morning, we have scheduled testimony from the city's Department of Public Health and the Department of Behavioral Health and Intellectual Disability Services. This afternoon, we have testimony from the District Attorney's Office. Ms. Lawhead, will you please call the first panel to testify from the administration?
The first panel to testify from the administration is Dr. Palak Raval Nelson, Health Commissioner. Also present, Ashley Clark Jackson, Chief Financial Officer, Sarah Inez Thorpe, Chief of Staff, James Garrow, Deputy Commissioner, and Don Kieswetter, Deputy Commissioner. We'll also ask that Kenny Solanke, Commissioner for DBH IDS, come to the podium. And also present with her is Amanda David, Deputy Commissioner, Behavioral Health Division.
Good morning. Good morning.
Good morning.
Good morning, sir. Good morning.
Just want to start off by thanking Dr. Pollock, Ravel Nelson for your work around the air monitoring initiative that we kicked off in Grays Ferry, South Philadelphia, and also just your work just in general as it relates to moving the city of Philadelphia forward and making sure we have a more healthy city, as well as Commissioner Kenny Salant. I want to thank you as well for most importantly your passion that you have brought to this position as we address the issues around behavioral health here in the city of Philadelphia as well. And so with that being said, please state your name for the record and please begin your testimony.
Good morning. My name is Dr. Pollock Ravel Nelson, and I'm the Health Commissioner. Good morning, President Johnson and members of City Council. Joining me today are Deputy Health Commissioner Sarah Innes Thorpe, Deputy Commissioner Ashley Clark Jackson, Deputy Commissioner James Garrow, Deputy Commissioner Dawn Kieswetter, and all of our division directors. I'm pleased to join you today to provide testimony on the Philadelphia Department of Public Health's fiscal year 2027 operational budget. The proposed FY27 budget was developed with the goal of supporting our ongoing mission. You have my full written testimony, so I will summarize. The proposed fiscal year 2027 general fund budget totals $158,498,176, which is a decrease of $6,816,066 over fiscal year 2026 estimated obligation levels. This decrease is due primarily to $9,981,127 in Class 800 funding to pay for capital to support our 2 new health centers. The Health Department is requesting 1,084 budgeted positions across all funds for FY27, which is a decrease in 8 positions from FY26 due to grant funds ending. Those are grants that are sunsetting, and that was planned. As a reminder, the mission of the Health Department is to protect and promote the health of all Philadelphians and to provide a safety net for our most vulnerable. We want Philadelphians to thrive, not just survive. Since I've started in this position, the values we strive to achieve are simple: integrity, commitment, and accountability. I often say that public health touches everyone's life every day. The work of the Health Department demonstrates that our staff provide primary care services to Philadelphians, promote vaccination for children and adults, help prevent the spread of HIV, investigate outbreaks and disease, inspect restaurants, inspect and treat for and teach residents how to prevent rats and other vectors, work to prevent lead poisoning in our children, combat air pollution and create better air quality, reduce infant and maternal mortality, promote the health of young children, and prevent heart disease and cancer by promoting healthy eating, physical activity, and smoking cessation, among the many, many other things that we do. I'd like to take just a couple of minutes to talk about some of the department's key highlights from last year. Looking ahead, many of our divisions, including disease control, air management services, and environmental health services, as well as our public health lab, have been preparing for the many special events that are going to be ongoing as we celebrate America's 250th birthday. These divisions ensure protective and preventive disease conditions so that everyone that comes here and all of us can join the festivities and be safe. As a part of this planning, our Division of Disease Control has also led public health planning for the 2025 FIFA Club World Cup and now 2026 FIFA World Cup, developing response plans for both events and conducting a series of planning workshops and exercises with partners that focus on responding to health emergencies during the events should they happen. Earlier this year, Air Management Services Division installed 76 Breathe Philly sensors in every neighborhood of the city. As you know, these monitors measure fine particulate matter, or PM 2.5, and nitrogen oxide in real time. There's an example of the monitors in action here. The map is over there where at the front there, showing a picture of the monitor as well as where all of the 76 monitors are located. Please note, we are the first big city in America to create a network like this. one that empowers residents to know exactly what is in their air and what they're breathing right now. We are already working to expand this network, both in terms of numbers of sensors and pollutants measured. So stay tuned for that. I'm proud to acknowledge that last May, all 8 of our health centers operated by our Ambulatory Health Services Division were recertified as patient-centered medical homes with the distinction of behavioral integration. Last year, the Philadelphia Medical Examiner's Office also interred all of the human remains of the victims from the 1985 MOVE bombing. Finally, we put them to rest with dignity in Laurel Hill Cemetery. And they are identified as such, so should the families ever want to come and claim any of the remains, they will be able to do so. Last winter, our Division of Chronic Disease and Injury Prevention helped lead the efforts by the Mayor Parker's administration to deal with the SNAP funding crisis. You'll remember that the city stood up an entire grant program in 1 week in order to distribute $2 million to 135 organizations to distribute healthy, high-quality, culturally appropriate, and appealing free food to all Philadelphians that were experiencing food insecurity. Our Division of HIV Health provided in-kind, point-of-care rapid HIV testing to the Philadelphia Department of Prisons, enabling the facility to finally qualify in FY26 for 340B drug pricing, which is a federal program that allows for eligible providers to purchase medications at a significantly reduced rate. HIV Health also stood up 5 public health vending machines, which provide free access to HIV self-kits, condoms, COVID-19 self-test kits, fentanyl and xylazine test strips, naloxone, nicotine replacement therapy, and wound care kits. There's a picture of what that vending machine looks like over there next to the Kensington Matters sign. You can see an example of those machines. They are located in 2025, our environmental health services once again met our interval to achieve a 12.5-month inspection interval. We know that when we get to every food establishment, that the food in our city is safer. Additionally, our Lead in Healthy Homes program increased the number of lead certifications, and we received 2 additional HUD grants to fund lead hazard remediation in our city. Our Division of Reproductive and Adolescent Health launched Philly Flow, which is an initiative to distribute free, high-quality period products across rec centers and free library branches, expanding citywide access and reducing barriers to menstrual equity for communities with the greatest need. Our public health lab established 2 5-year contracts to ensure that we have what we need to perform gonorrhea, chlamydia, HIV, and hepatitis testing with the School District of Philadelphia. And we are eagerly awaiting our brand new lab trailer that will be capable of testing dangerous pathogens, as we approach the 2026 event season. The Division of Substance Use and Prevention and Harm Reduction, or SUPR, responded to the introduction of medetomidine into Philadelphia's drug supply by helping to develop and disseminate best practices for treating medetomidine withdrawal, distributing medetomidine test strips, providing updated overdose reversal training, and conducted syndromic surveillance. SUPR also supported the launch of Philly Flush, public restrooms that was installed in Clark Park in October of 2025. There's a picture of the actual flush contraption at the front of council. If you haven't seen one, you can look at that picture, and there's also going to be a grand opening across the street. There are so many things that the health department staff have accomplished, and I could go on forever. But I want to be cognizant of your time and allow for questions. So to close, thank you, Council President and the esteemed members of Council for your continued support of the Public Health Department and public health in the City of Philadelphia. And at this time, I'd be happy to answer any questions you may have.
Thank you very much.
Good morning, President Johnson and members of City Council. I'm Kenny Shalanke, and I have the privilege of serving as Commissioner for the Department of Behavioral Health and Intellectual Disability Services, DBH-IDS. Joining me today is Amanda David, Deputy Commissioner overseeing the Behavioral Health Division. I'm pleased to provide testimony on the DBHIDS fiscal year 2027 operating budget. You have my full testimony. I will summarize today. DBHIDS envisions a Philadelphia where every individual can achieve health, well-being, and self-determination. The mission of DBHIDS is to educate, strengthen, and serve individuals and communities so that all Philadelphians can thrive, enjoy an improved quality of life, and benefit from city services that residents can see, touch, and feel. Thank you for the opportunity to present our FY27 priorities. Today's testimony will focus on three key areas. First, the continued transformation and performance of our crisis response system. Second, the progress we've made around substance use treatment access and ongoing outreach in Kensington. And third, how we are strengthening system awareness, accountability, and preparing for upcoming Medicaid changes. I will also outline the risks we're actively managing to ensure continued access to care for Philadelphia residents. Our crisis system. With Council's support, DBHIDS has built a comprehensive crisis continuum that is producing measurable results. In 2025, calls to the Philadelphia Crisis Line increased 10% to over 79,000, and 988 call volume increased 24% to 31,692 calls. 83% of our 988 calls were resolved on the phone. 15% resulted in a mobile crisis dispatch, while 2% agreed to go for further evaluation at the Crisis Response Center, and 1% required emergency service dispatch. Our mobile crisis median dispatch to arrival time improved by 17%, from 46% in 2024 to 38 minutes, 46 minutes in 2024 to 38 minutes in 2025. A comprehensive quality evaluation completed in partnership with the University of Pennsylvania found that mobile crisis services avoided over $4 million in acute inpatient psychiatric spend between 2022 and 2024. Additionally, Philadelphia's first adult behavioral health urgent care center, which opened 19 months ago, has completed over 5,000 same-day encounters to date with no appointments required. Substance use treatment and Kensington outreach. We added more than 400 treatment beds across 12 new sites through a competitive procurement in 2025, and we currently have access to over 2,400 licensed substance use disorder beds across the full continuum of American Society of Addiction Medicine, ASAM levels of care. We are not aware of any systemic barriers to accessing these beds. We launched Philadelphia's first mobile methadone van, bringing medication-assisted treatment directly into Kensington and soon to other parts of the city. And our centralized bed registry is under contract and on track for initial implementation in December 2026, replacing the manual phone-based referrals with streamlined referral processing and real-time bed visibility. Kensington remains a top priority for the city and for us. The Mayor's Wellness Ecosystem offers a coordinated citywide strategy to address homelessness, substance use, and social determinants of health through integrated low-barrier services. DBHIDS funds behavioral health wraparound services across every wellness ecosystem location, including Philly-Homer Girard, Riverview Wellness Village, the Neighborhood Wellness Court, and the 1,000 shelter bed expansion sites. In partnership with the Office of Homeless Services, DBHIDS administers the One Philly Wellness vouchers, supporting individuals in recovery from opioid use disorder in securing independent housing. In 2025, our homeless outreach teams assisted with the placement of 323 individuals at Philly-Homer Girard, and we facilitated 474 admissions into Riverview Wellness Village. Our homeless outreach teams made over 44,000 unique engagements citywide in 2025, and of those engagements, 64% took place in Districts 1, 5, and 7. Notably, however, District 7, where we see the most outreach activities in Kensington, there was a 19% reduction in contacts, yet a 24% increase in contacts that resulted in placement. Additionally, to increase awareness of behavioral health services in Kensington, DBHIDS developed a targeted behavioral health resources mailer in English and Spanish delivered to 1,843 businesses and 22,579 residential addresses in the 19134 zip code. We also launched the Kensington Children's Task Force, a cross-agency, cross-systems effort aimed at developing actionable plans to support children's well-being in the community. And you can see all of the system partners that are involved in the Children's Task Force, so over 100 individuals. So we're incredibly excited about what's possible. Medicaid risk and preparing for 2027. The federal Medicaid changes taking effect in January 2027 pose a serious and immediate threat to Philadelphians' access to behavioral health care. The new work requirements and the more frequent recertification mandates could result in approximately 73,248 Philadelphians losing Medicaid, disproportionately impacting those with the fewest alternatives. And we have those numbers up there. You have the Pennsylvania impact as well as our local Philadelphia impact, and we'll talk more about that. In anticipation of these changes, the Managing Director's Office of Health and Human Services has engaged a consultant with deep Medicaid experience to work across city departments and external partners on 4 areas: enrollment and re-enrollment, community engagement, financial assessment, and technology solutions. While DBHIDS is an active partner in that effort, we are also working in parallel to prepare a provider network and the community for potential impact. Our behavioral health system is also operating under workforce strain that predates these federal changes. A stable behavioral health system is part of the infrastructure that makes economic opportunity real for all Philadelphians. Philadelphia provider organizations and DBH have raised with Pennsylvania Department of Human Services the need for a statewide investment in competitive wages and provider infrastructure, a statewide behavioral health career recruitment campaign, and a long-term workforce commission with county-specific planning. And so in closing, I want to say, and I'm proud to say, that our collective investments are working. We have expanded crisis response. We've improved access, and we are strengthening outreach. Behavioral health is foundational to the mayor's vision of a safer, cleaner, greener Philadelphia with economic opportunity for all. Residents who are connected to care are better able to participate in their communities, sustain employment, and contribute to the city's economic life. But our system is under pressure from workforce strain, and federal changes to Medicaid represent the most significant risk ahead. With tens of thousands of Philadelphians at risk of losing coverage, our FY strategy is focused on 3 things: mitigation, continuity of care, and equity. Protecting that access is inseparable from the mayor's commitment to a safer, more equitable Philadelphia. Because residents who lose behavioral health coverage, they do not disappear from the challenges that we're all working to address together. DBHIDS remains committed to building a system that is responsive, coordinated, accessible, ensuring that every Philadelphian can connect to care when and where they need it. My colleagues and I are ready to answer questions you may have. Thank you.
Thank you very much. Just a couple questions I just want to ask you, the 2 of you. I want to start off by acknowledging, excuse me 1 second, Member Jones. Morning, sir. I want to start off by acknowledging part of the leadership team, LaVanne White and Dr. Marquita Williams, for their hard work and their dedication in terms of making sure the lines of communication are open with members of City Council regarding DBHIDS, and just overall, just the good work that they do. So I just want to acknowledge that publicly, that you have a good, strong leadership team working to make sure you continue to move the city of Philadelphia forward.
Yes, sir,
And
thank you.
you're welcome. And Dr. Patel, I'm thinking about, I'm sure a couple members are going to talk to you about our health centers that are coming online, particularly up in the Northeast, which is something that Councilmember Chair of Health, Dr. Nina Ahmed, will surely have questions about. Think about the role that you play in terms of providing high-quality health care for those most in need. And so I can't speak for everybody else, but, I come from humble beginnings, right? So before University of Pennsylvania, Penn Medicine became my doctor, I attended the health center at Broad and Morris in South Philly as a kid growing up. My nana would take me there to get my shots, and I would go there to get my yearly checkups, me and my sister, and all the rest of the family. And so it really just crystallizes on the importance of your work. Because I remember as a kid, we would be in the waiting room, and the room would be full, right? But that's also what some of the best experiences that helped me become a healthy young man growing up. So thank you for your work. I want to start off by talking about an issue that's very near and dear to me, which is gun violence. I want to talk about how the Chronic Disease and Injury Prevention Coalition, I remember it started around when Dr. Ruth Abaya was around. Myself and Councilman Jamie Gauthier, we advocated for funding to support a dashboard where all the hospitals working together could have support as they address the issue of gun violence as a public health epidemic. Now, at that time, maybe 2-3 years ago, remember, Jones could remember this as chair of public health, it was like the buzzword. We have to address gun violence as a public health epidemic. And now we're on to the next thing, which is affordability. But I'm still focused on that key issue around gun violence as a public health epidemic. And so can you give me an idea on what are we doing to make sure we continue to push forward the Chronic Disease and Injury Prevention Network, and what's the status of that coalition, as well as the dashboard as we address gun violence from a public health standpoint?
Sure. Thank you for that question, Council Member. So gun violence is a public health issue, right? Public health touches everyone's life every day. We have worked through the leadership of Dr. Kinnari Chandriani and Pilar Ocampo. We have worked to create a Violence Reduction Council. We have initiated, so we are working with the police department, with the Office of Public Safety, as well as a host of partners to look at reducing gun violence as a holistic approach, hospital-based interventions. We've gotten the group together. We've had about 2 meetings, so part of that offset is the dashboard. And we started this work mid last year, sir. And since then, we've brought the coalition together twice, and we're looking at how the violence occurred and then tracing it back and really getting focused. And the dashboards are an ongoing project, and the hope is that they will be, hopefully be ready by the end of this year.
Could you provide to myself and members of council the members of the Violence Reduction Council, and then also ways that the Special Committee on Gun Violence could be supportive and involved in the process?
Absolutely. Would that be okay if we provide that after budget?
Absolutely.
We'll get you a full summary, sir, along with all the members of the actual working group, the training we've provided, so that folks know how to look at gun violence appropriately, and we'll also go ahead and get you the members of the executive committee as well as an update on the dashboard.
Bless you. And I would assume that the mayor's office of violence prevention, public
Yes.
safety is a part of this overall strategy as well?
Yes, the chief of staff, so Director Gear, as well as we have our deputy managing director, Crystal Yates-Gale, leads with the managing director's office, and then we have Commissioner Bethel and/or his appointee that join the group. Yes, sir. We're all working seamlessly. The mayor talks quite often about breaking down silos and, not being in ivory towers. We're all working together.
Good. We want to continue being partnerships, and when I say we, meaning not just myself, but members of council in these efforts, so please keep us updated.
Absolutely, sir.
Although we're at a 60-year historical low when it comes to gun violence and homicides, our overall goal is to eliminate gun violence in the city of Philadelphia. So now we should be doubling down our efforts now more than ever when it comes to looking at the root causes of gun violence and addressing it from you, as you would say, from an epidemic standpoint. And so, thank you on that area. I established the Food and Nutrition Security Task Force. Matter of fact, my team just had the opportunity to go to Washington, D.C. on my behalf, City Council, to talk about the work that we're doing to address food insecurity here in the city of Philadelphia. And one of the key things that has come out of the recommendations is how do we focus on or doing a better job of regarding collaboration across all city agencies to address food security. And so can you give us an idea? I know we did the one-time investment as relates to the cuts around the SNAP benefits, right? But to be more direct, what are we doing to better collaborate with other city agencies around food insecurity and your strategies from a health department standpoint? Two, we know from Washington, D.C., the new policies require individuals to reapply and meet a certain type of criteria to be eligible for SNAP benefits. Now, I'll say publicly, we could probably be supportive of addressing the food security standpoint, but we don't have a budget to really do a super deeper dive when it comes to filling that overall gap, which is billions of dollars of individuals who receive SNAP benefits. But one of the key ways to address is making sure we're supporting individuals to reapply and just meet their proper criteria. And so what is your strategy to meet the moment in that area?
Sure. So once again, our Division of Chronic Disease and Injury Prevention has a whole subset of folks a manager that works specifically with food insecurity and as well as water safety and water security. And so we are working together with partners. So there are folks, as we know, with the summer months coming, kids who normally receive benefits through the school system will be at play streets and other things. So we're working holistically across the board to make sure that there is adequate, safe, and healthy food available, but we're also doing the work in the background, having the appropriate meetings with the various partners and departments, as well as our DMD for Health and Human Services. It has been convening groups where within our health centers, we have counselors to help folks with both the Medicaid requirements and recertifications, and as well as helping them with the SNAP applications and recertifications. We can get you full details on all of our work.
Okay. And in terms of your team, who is I guess I would say the food security czar that walked us through this moment in time?
Sure.
Because most of us in here are, I guess some people call us professional, and pretty much everybody in the crowd, right? But there's a population in Philadelphia that really needs us to fight for them now more than ever. And part of that is making sure the qualification process so people can reapply and they don't lose so they won't lose their benefits, right? So who would be that point person?
Sure, absolutely. And I just want to say before I give you the name, sir, as someone who had a child in their 20s and was on Medicaid and benefits, I can relate to how complicated the application process is. I've been a fairly perfect A student, but I failed that application multiple times, and it was very scary. So our main person that focuses on that her name is Mika Root. I'm sure folks probably saw her on the YouTube videos when we were rolling out the SNAP grants, and then Dr. Chandriani. So we will get you full details and the full plan that we're working on.
Are we partnering with any workforce agencies to make sure individuals, so let's say they have to do volunteering, they have to work a certain amount of hours to qualify? What agencies and what's our strategy to meet the moment from that aspect?
Sure, and that is one of the reasons why, as my colleague mentioned, Dr. Solanke mentioned, our HHS Deputy Managing Director, we've hired a consultant specifically with the Medicaid benefits and the
So they're doing
benefits.
both?
Yep,
Okay,
Yep,
good
we're
to hear
doing
that.
both,
Good, that's
and-
that interagency
Yep.
working together. Good,
exactly.
okay,
And if you, do you mind if I just say a little bit about what we're doing related to that?
sure.
We do have a social determinants of health and equity unit within DVHIDS that is partnered with the food engagement through efficient delivery services called Feeds and Fill Abundance. And so we're able to deliver 1 year of free food to up to 50 families. And so they get this bi-weekly. It's boxed food as well as prepared meals. And we also are able to provide technology, which is, we did a survey that identified 5 main areas that people indicated that they needed support with: technology, transportation, food, and workforce. So our SDOH team, that's headed by Laura Jordan, that's our point person for our food initiative, is actually responsible for providing all of those supports to the individuals that apply.
Okay, awesome. I like how you got her back.
We work, tag
like
team
that.
it, sir.
Yes.
Yeah, I
Tag
like
team
Hand in
it.
hand, leg in leg.
Good,
Yep.
like
Along
that.
with Cheryl Hill. That's our
Yes,
third
that's
person,
our
our
third
third.
stool.
Yes, yes.
Three-legged stool.
That's what's up. The Good Food Procurement Coordinator, that position has been budgeted for $76,000 and still remain unfulfilled for a particular period of time. What can we do to fill that position when it comes to making sure that we're advocating, we have an individual who's focusing on procurement from a food justice standpoint?
So I believe that position recently became vacant, sir. We had an individual who was with us for a long time. People have kids, priorities change. So we are in the process of actively recruiting to fill that position. But in the meantime, we are working collaboratively to ensure that the work is getting done.
Okay, good to hear that. I saw a report that talked about our air quality, right? Philadelphia received the F, right? And I remember we kicked off the air monitoring initiative, so I thought that was great. Then I see this report as recently as last week that talked about our air quality. What is our strategies to make sure?
So I'm a little surprised. I didn't see that report. We've been, we monitor, besides
Came out
having,
April 28th.
I will, do you know, well, I can get details from your office, sir.
Yeah, I get it to you. And I'm not trying to gotcha either. It's
No,
just
no,
legitimate.
no, absolutely not.
Question.
I'm just curious, right, because we
Report
have,
about HYY.
we always have folks, and as they should, they, you know, should be watching, they should be keeping tabs on us, but just for clarity, before I answer regarding what was discussed in that
Just for
report.
the record, this is by the American Lung Association.
Yep.
That's
and-
that provided the report.
And they were alluding to the higher benzene and associated with recent wildfires. But I want to clarify and mention, so we have 11 hardwired monitors throughout the city of Philadelphia. They are, that data goes directly to the EPA, and that captures all of the details. Those were the monitors that we used during the Canadian wildfires. If folks recall, we had put out an alert that said, you know, please stay indoors, wear masks and everything else, because the level of the air quality was, I never thought I would see purple, but, you know, it goes green, it's color-coded, so we were fairly high. And we were able to toggle to that. Now, the story that you're referring to is talking about higher benzene levels, and that's due to wildfires. However, if there was an imminent threat, so besides having the 76 monitors that folks can go ahead and get details directly on their phone, we would have put out an alert. I believe the report analyzed items from the past, but again, we'll look at the article and get you a full update.
Do we have, because some of the things you talked about is more responsive, do we have a strategy that looks at a variety of different categories to have an impact on the quality of our air and begin looking at policies to implement or to propose to address those various types of initiatives or developments that will have an impact on our environment?
Sure. So we absolutely do, sir. And we have, the Health Department is responsible for the Air Pollution Control Board as well, who sets, it's similar to our Board of Health. We go ahead and we draft regulations and go through the public comment period for the regulation process. Our Air Pollution Control Board, 2 years ago or 3 years ago, passed AMR 6, which is the regulation that restricts Title V emitters, which are the large industries, from polluting into our air. It puts, it increased the number of toxicants, so to ensure that folks were not spewing things into the air. We also, a couple years ago, began down the path of making sure we have a process in place when we have our junkyard fires that occur in our city. We went ahead, we have an environmental justice manager who works with our air management services director, and they went to every single junkyard that would have them. We worked with LNI because LNI is the one that licenses them. We trained them to make sure that they knew what and how to store things that were appropriate so things did not combust during heat waves and heat-related incidences. And along those lines, we have our entire emergency messaging system that goes into effect when there is an issue, whether it's a fire or something, so that we can alert residents immediately about what to do regarding their air quality and whether it's to, shelter in place or to ventilate or to wear a mask. So we are also working, we recently passed a regulation on crematories and what they were allowed to put into the air compared to what they were allowed to put into the air before. And we are also looking at mobile sources of air pollution. We're working with the Mayor's Initiative and our fleet commissioner to roll out our vehicles and change them out for electric vehicles.
Okay. All right, thank you very much. And Dr. Solanke, just have a quick question. I wanted to ask you around the issue of trauma-informed support for our young people. I know the school district of Philadelphia has an initiative called Hazel Health that provides free therapy for young people. One, are you aware of the initiative? Two, how impactful it is. I think when you talk about the issue of gun violence, again, we have a lot of our young people walking around dealing with, I call it post-traumatic stress disorder, because they're living in an environment where they're seeing their friends being shot, when they're seeing their friends being murdered, and they have to return back to school day in and day out, right? And so the question is always, how are our children doing? And who's checking on our children? And I think about how are they processing the level of violence that they're seeing in our neighborhoods day in and day out. Just want to get an idea on what your office has been doing around this particular issue, as well as the Hazel Health Initiative as well.
So we're aware of the Angel Health Initiative. We actually help to promote that. We don't pay for it, but we do make sure that whenever we are messaging around school-based services, that's an option that's readily available to schools and to students. But with regards to trauma, all of our programs, all the programs and the providers that we contract with are required to provide trauma-responsive care. That is an expectation across the board. But we also have specific trauma programs, especially for Black and brown youth that have been exposed to gun violence, and it's called Trauma to Triumph. It was launched in 2024, and it's a 12-week model that happens 5 days a week after school, and it's a space where youth can, it's a safe space for them to kind of express themselves, to feel joy, and to talk and connect about what it's like to live in an environment and to have to endure so much trauma, and to really think through how trauma shows up in their personal lives and in their communities, and they get some coping skills around that.
Do we have any initiatives where we partner with the Philadelphia Police Department to work with officers as they deal with the issue of trauma, as they see them doing their day in and day out duties?
You mean specifically working with the police department? We have a network of neighbors team that can provide support to not just city agencies, but also to communities if they have been exposed to trauma or stress or any kind of violence. And I know we have actually activated a network of neighbors for the fire department, for the police department, more recently the sanitation department, streets department. They're go-to for a lot of our city agencies when we go through, especially with the Garage Street, the tragic accident. So we have the different entities that were involved that have been supported by our network of neighbors.
Have we increased the number of staff for Network of Neighbors? This is prior to you coming. And this when gun violence was like at an all-time high. And it was like 2 people for the whole city of Philadelphia. And we on the ground day in and day out addressing this issue. And Network of Neighbors
Yes,
would
sir.
come out,
Yeah,
but they can't be in South Philly and
yes, sir.
Mount Airy at the same time.
Yes,
And we were advocating at that time to see if they can be in a level of expansion
Yes.
because it was such a
we have
dire
increased.
need for it.
Yes, sir. We have increased the staffing, and it actually allows them to your point, to branch out, to respond to other trauma incidents across the city.
What's the total number today? 10 staff, 15 staff?
I don't want to guess. I know it's in this folder somewhere, so I can get that to you at the
Okay.
end of this
All right,
hearing. Yes.
all right.
I think
please.
we're almost there.
Okay, good.
Definitely more than 10.
Good to hear that.
Yes.
All right. Thank you very much. The chair recognizes majority of
It's
the cap.
12.
It's 12?
Yes, sir.
Oh, see, now, a couple years ago, it was like 2. Good job.
But I think we also have them do train the trainer. So it really doesn't have to live with the 12. They train the communities to be
Yes,
able
they
to.
do.
Right, to be able to provide ongoing support so that they can
Yes.
move on to other areas of the
I
city.
agree. I think 20 is a good number to train the community.
We'll be happy to have 20.
Because we want to make sure, right, on this gun violence issue, we want to
Yes.
eliminate gun violence, right?
Yes.
We don't want to rest on our laurels that, we're at a 60-year low and it's a historical low. Then we start pulling back on resources and start focusing on other areas where
Right.
again, I'm a firm believer, okay, we had 12, let's shoot between now and a particular period of time to get 20 because again, the ultimate goal is to live in a city where
Right.
there is no gun violence, and we can go a summer without violence. And so that behavioral health component plays a major role in terms of how we process trauma, because hurt people hurt people. We know that.
Absolutely.
Rather it's children, rather it's adults. And so I commend the
Yeah.
2 of you for the work that you are doing and actually working together
Yeah.
on this issue. Majority Leader Kathleen Gilmore Richardson.
Thank you. Thank you so much, Council President, and thank you all so much for being here. I wanted to start with our thank yous for our Health Commissioner, Dr. Palak Ravel Nelson, to Dawn, I'm going to always mess up Dawn's last name, Dawn K. Thank you, Dawn. You were out with us years ago during the pandemic when we were going store to store doing those inspections with my district colleagues. So thank you. Thank you very much for your great work. James Garrow, Sarah Ennis, Dr. Mehta, thank you for your work on the maternal health work. Carla, Irie, Benjamin, Hartung, and then for DBH IDS, thank you, Council President, for recognizing Dr. Marquita Williams, who served with excellence. Of course, LaVann White, thank you even for your help on Friday afternoon. We received a case, and it was the middle of the May Day activities downtown. So thank you for helping us get assistance for that 81-year-old constituent. And Malik Gray, thank you so much, Malik. Malik joins us every single year for our grief and loss workshop around the holidays. And we've been doing that every year since the pandemic virtually, and it's always very well attended. So thank you very, very much also to Malik Gray. I wanted to start with health. Relative to, again, saying thanks for your work around maternal health. And I see some of our organizations are represented here, including Oshun. But wanted to, on the record, just get an update on all of our maternal health funding for the entire FY 26 and then going into FY 27. And then also, if you could talk about I noticed in your budget detail that there is funding for teen contraception, the doula program staffing, home visiting for young mothers, family support services, the maternal mortality action team, and the pregnancy risk assessment program. Will there be an increase of funding for that work, or will there be a decrease? And if so, how much, and what do we need to do to ensure that work is adequately staffed and funded?
Sure, we're going to keep everything at level funding.
Level funding, okay, great. Okay, excellent. And then could you just provide additional detail for the new Severe Maternal Morbidity Review Committee?
Absolutely. If it is okay with council member, we will get that to you after.
Okay, that'll be great. And then my last question goes to the legislation that I had recently introduced, which would allow the city to hold commercial landlords accountable when they knowingly allow their tenants to sell tobacco without the proper permits from the city. And so if you could just talk about how many citations have been issued for unlicensed tobacco retailing this year, and how do you work with L&I and other departments to ensure coordination of inspection and also enforcement? And we get a lot of complaints around these unlicensed tobacco dealers across the city. You know, they typically have medallions from other states, they're buying cigarettes from other areas, and then selling them here. And we've gotten a lot of complaints. I know we met with a group in Councilmember Lozada's district even about a year ago, where they expressed their consternation relative to these stores and vendors who are selling cigarettes and tobacco unlawfully. And so just wanted to get an update on tobacco enforcement.
Sure, absolutely. So when it comes to tobacco enforcement, the health department issues a tobacco permit for folks. We are capped in most of the districts, so the number of permits that are available in those districts don't go above a particular cap. However, people can get a state license to sell tobacco, and often people try to use that license to sell tobacco.
Right.
In order to sell tobacco legally in the city of Philadelphia, you must have a state license and you must have a city tobacco permit.
Yep.
In terms of enforcement, we have about 2,500 legal licensed establishments, and we will go ahead and get the exact number for you. Our food protection staff, the ones that conduct inspections throughout the restaurants, because these stores have a food component, during the end of COVID, and council member knows this, we integrated in a cost efficiency matter. So now everybody does inspections and looks for tobacco products. So these are the places that are permitted.
Excuse me, Commissioner.
Yes.
1 second. Point of information, Member Young.
Thank you, Mr. President. Along the same lines, when the state provides a business with their tobacco license, is there any, do they talk to us to say, hey, can this person legally operate, or is what's the process in that?
Sure. So they don't necessarily talk to us always. The folks that we work with are actually the state revenue folks that do the enforcement for the illegal cigarettes and everything. But we are working on that relationship to improve that and better that, so that similar to what the Liquor Control Board does, and we check in with them about licensed establishments, we are working on that aspect with the state. But most of the time, they just issue the tobacco licenses.
Is it possible that we have to issue ours first before the state can give theirs in the city of Philadelphia?
So tobacco laws, we are preempted from a lot of the tobacco work. So, but we can absolutely explore that from a collaborative approach, sir, to
Thank
figure out how we can encourage them to do that.
Thank you, Mr. President. Thank you, Madam Leader. Thank you.
No, and thank you, Councilmember Young, because I think that's an important question, and I think we should explore that with our state colleagues. And part of the reason why I did bring this question up is because I had a conversation with one of our state representatives from the delegation who talked about the continued challenges because of the state preemption on tobacco and the challenges that we have because we are capped at the number of permits that can be issued per district. So I think that's an important follow-up that we can work together on to ensure that we work with our state partners to figure out how we could possibly put the city process in front of the state process, or at least make it a requirement or a part of the process.
We can absolutely partner to work on that. And then just to finish the answer to your question about enforcement, if establishments are selling tobacco products and they just pop up, so that is based on a complaint basis, not on the ones that are permitted, we go out and conduct an inspection, and then we work directly with licenses and inspections but we have the authority to cease operate folks, and we will, and you yourself have put a sticker up on a door, so smiley candy. And then we follow up. We will also do a 14-day cease now. We have that authority.
Okay.
And we are working with LNI. We're also working with our law department to determine the next steps for how do we suspend or revoke a license.
Okay, that'll be great, because I think most of what we heard from some of the retailers that are legally allowed to sell tobacco is that they felt as though they were being targeted versus the locations that are like the illegal pop-ups that really don't have any permits or licensing to sell tobacco products at all. And so I think that's the challenge that we have at this point. But I heard the bell and I want to honor the clock, and so we will certainly follow up on this. We plan on having hearings on this legislation hopefully very soon, and we'll do the additional follow-up at that time, and also follow up with my colleague, Councilmember Young, to coordinate with our state as well. Okay? All right,
We will
thank
welcome
you.
that. Thank you.
Thanks a lot. Thanks, Councilmember Young.
Chair recognizes Councilman Jim Harity.
Thank you, Council President. Good morning, everyone. Thank you, as always. You guys do very hard work, and, we asked a lot of hard questions, but want to make sure we thank you also for everything you do. I'll start with public health. I'm going to ask my questions for public health and DBH-IDS, and then you can answer just for time. There's been a rise in Krypton addiction in Philadelphia with powerful extract sold as 7-0 in smoke shops, increasing stimulating opioid effects. Is the DBH tracking Krypton and 7-0 related harms, hospitalizations, overdose calls, treatment admissions? Is there any FY27 funding to monitor or respond to it? That's for public health. And then DBH-IDS. The Inquirer reported last week Judge Simmons was ready to shut down the wellness court over frustrations with the lack of coordination and communication from the administration. The administration says the changes and delays were due to administrative protocols that need to be resolved. In your opinion, what is the biggest obstacle in streamlining the process to get people into wellness center program? We all want to work and are committed to doing so, but we must be able to identify any issues we are facing and correct them as soon as possible.
I'll have Dr. Pollack speak first.
Sure. So we know that it's just like metatomidine, right? The more we get a handle on certain substances, newer substances pop up. As far as kratom is concerned and kava, Dr. Danny, who's our super director, has already been ahead of this. We've developed a comprehensive one-pager on what to look for and what to be concerned about with this substance, and we are working to not only ensure, so when we go into a food establishment, sir, so that's usually where they are, infusing your beverage with kratom, or when we're going into the places where people are selling items, our staff are getting the training so that they can, right now, we go ahead and we would retain those items or have them, and retainment means we have them take them off the shelf and they're not allowed to sell them, mainly infused products. A lot of places advertise on the outside that they're selling kratom and everything, and during the course of the inspection, it's products that say kratom on the front but don't necessarily have a kratom content. So we are doing our darndest to be fully educated. It's another way of making sure that there's no silos within the health department. So our super division is educating our inspectors and everybody else, so we're on the same page. Right now, we are retaining those products when we come across those.
Okay, thank you.
And
Yes.
very quickly, so when individuals come into the wellness court, our teams process the individuals and do the assessment for treatment and follow-up. And we've actually increased the number of staff that are able to do that. The process is related to whether they go for a hearing in front of a judge. It's a little outside of our jurisdiction, but for the folks that we assess, that we process and refer to treatment, we're not seeing any lapses in care coordination. So if there's a little bit more specific, what part of that assessment or what part of the referral or what part of engagement that's getting lost, we'd like to get more information so we can address it.
Okay, I mean, it was in the Inquirer, so,
Okay,
you know,
we'll read
and
But that's, that's sometimes a suspect.
yeah, well, I get it, I get that too.
They ain't the
We
holy-
believe the
They
inquiry.
ain't the holy grail.
No, I get it, I
They'll
get it.
probably ask me about it later on, but it is what it is. Remember, Harry, go ahead. So I'm just joking.
No, I know, I also get that, but it's not the first time I've heard about it.
Right.
Okay, so let's put it that way.
Right.
There have been some challenges that we faced. Not trying to point a finger at anyone, just trying to see, so many times we dig in instead of admitting that something's not working and try to figure out a fix. Just want to make sure that we're looking at everything and looking at
Absolutely.
the process, because
Yeah.
the process is for us to actually get people into treatment as fast as we can, especially if they're ready. Thank you.
Yeah,
And
thank
Council
you for
President-
raising that. I know
Yeah.
that we're still in the first year of operation, so there will be bumps along the way, but we're committed to looking into what the concerns are around follow-up and care coordination so we can address them immediately.
Okay, thank you. Thank you, Council President. I heard the bell.
Thank you, Member Harry. Councilmember Cindy Bass.
Thank you, Mr. President. Good morning. How are you? How's everybody doing? It's good to see everyone. I just want to start, I think our Majority Leader, Kathy Gilmore Richardson, thanked everybody already, but I'm going to just echo her sentiments. Thank you so much for all of the hard work that you all do through challenging times, through difficult budgets. We know it's not easy. And then you have to deal with us on the phone on a regular basis too. Often upset, complaining, worried, just really having a challenging situation in front of us. So I just really wanted to say that. I also wanted to give a shout out. I saw in the back there, Rashida Perry Jones, who has done some great work over the years. And Rashida, I'm gonna give Rashida a clap. So Rashida is someone that I've known and worked with in this space for a very long time, and who's really, one of the best subject matter experts in my
Can I
opinion.
second that, please?
Yes.
You want to second that?
Yeah, I second that.
Okay.
Yes.
All in favor?
All in favor, say
So, but really, seriously, thank you all for all the work that you do. I just had a couple of businesses. I'm really following up on some of my colleagues' questions. And I wanted to start in with nuisance businesses. As you know, Dr. Nelson, it's been an issue. We've talked about it
That's
many times. Can you talk a little bit about the regulation of some of these establishments? Because not only are they not really selling food in the spirit of which it's regulated through the city and the Commonwealth, but can you talk a little bit about the cleanliness of food establishments and the health department's role? Because one of the things that greatly concerns me is you'll go into these stop and goes, they're really not selling food, and in my opinion, there should be a number of reasons that they could be shut down, reorganized, however you want to do it. But the cleanliness is a problem. These places are not clean, and they're supposed to be serving food. The floors are dirty. I've seen cobwebs. I've seen, all kinds of stuff. I've seen blood on the floor. And so what is the health department's role in determining cleanliness and the pass, whether an establishment, a food establishment, passes the muster or not?
Sure, absolutely, council member. And so the health department, we have a 54-point check inspection system. It's a risk-based inspection system. So we look at the first 27 criteria and categories are, they're the risk-based items. So for instance, not improper hand washing, those sorts of things. And then the remaining 50 up to 54 are all about good retail practices, which are cleanliness and other items. Now, the risk-based higher level criteria violations are considered more likely to get a closure because it's like lack of hot water and everything. However, the cleanliness-related items, the good retail practices, do add up. If an establishment is out of compliance in those areas, we take the appropriate action of doing a re-inspection, and then if they're still not in compliance, we will cease operate them, and they will be closed for 48 hours. I know that when it comes to our stop and goes, and this is the thing that I think you and I have been trying to sort out since I was an environmental health services director, right? How do we address those places that have the 30 stools on the side and say, hey, I met my criteria. How do we address the fact that I have 30 oodles of noodles in a microwave? Is that deemed food, right? A lot of this is because it is, those requirements are a part of the liquor control code. What we have done is to try and work out, go ahead.
Okay. But the liquor control code, it regulates the sale of alcohol, not the sale of food. The food portion is the city's responsibility, if I'm correct.
It requires, so the code does require that there is adequate food for up to depending on the license, whether it's the large or the small, for enough people. You're absolutely right that the quality and the safety of the food, that is within the purview of the health department. But if someone has, where we face the challenge, ma'am, is that if someone has 30 oodles of noodles, which they can probably outlast, nuclear warfare, there's not a whole lot of food safety challenge, there's not a whole lot of food safety issues, right? Similar to like a normal restaurant, we can go in and do an inspection. If the food temperatures are out of temperature, we can go ahead and cite them. We can make them get rid of the food. So what we have been doing, because I was anticipating your question, and you, ma'am,
It's the same every year.
Yeah, same every year, and we are going to figure this out, right? We go and test out places to see if they're selling shots. We do that together jointly. You're not the only one, Councilmember Gilmore Richardson, that we go out in the field with, but what we have started doing is a seating criteria. So essentially capturing, right, because if you are going to have a license that makes you a restaurant, it's not enough to have just 30 chairs, but space, whether it's 12 inches by 8 feet. And so you can't just have that counter, that makeshift counter that they have, where they say, oh, this is the table. So that is what we're working on. We're also working on making sure that they have a valid, legitimate menu and other things. So what I would like to propose is, as soon as we're through the 2026 events, if we could have a separate meeting and you can do the assessment and we can share the data.
Well, listen, so, Dr. Nelson, because, we just love you so much, I'm inclined to say yes, but I also want to say no, because it's been like 9 years since we passed the bill. And like I said, I'm asking these questions every year, like, when are we going to see the level of change that we need to see? Because these establishments are a problem in the neighborhood. These in my opinion, promote addiction. It's sort of like a easy way to acquire, like a shot of liquor, and they have the medications that you can mix and make it speedball, or, whatever you want to make. It's all kinds of concoctions that you can make with medicine and then with a shot of alcohol, and they sell it all. And they have the crack pipes. They have, they got what you need if you're looking to get down. when are we going to see some level of enforcement that's going to change that? Because, when we look at homicides and whatnot, like a lot of times homicides occur there. Like I said, I've been into these establishments, one, fairly recently, and there's blood on the floor from a fight that just had occurred. And the fight was over, the people were gone, but the blood was still on the floor. And so how do we, how and when are we going to finally see some level of improvement on these establishments? Because we're just not there. We're just not there.
Sure, and so, ma'am, if the blood was on the floor and we showed up to do the inspection, we would have cease operated them to clean that up, right? We quite often close places down because of their violations. They stay closed for 48 hours, and then they're allowed to open back up because they're entitled to a reinspection, and they get everything cleaned up, and then we have to open them back up. So this is why the seating criteria concept is so important, because I think it'll make a more pronounced, longer effect, and it will also help us to collect the data so that then we can work with the LCB to impact their liquor license.
Okay, I'll come back around and honor the bell, but I still think that, we've been doing the same dance for a long time
And
now.
we close them down, and they correct their violations, and we're required to let them open back up, and
It's just not right. It's just not right, so, but I'll come back.
I think we may have to come up the northwest of that bullhorn.
Say again?
Come up your neighborhood with the bullhorn. Shut them down.
Listen, we got the bullhorns. They don't care. They don't care. They operate any way that they want to with immunity. Like, they just don't care. They just aren't concerned about our communities, our neighbors, the products they sell. They sell to people who are already inebriated. Like, we know what it is. We know what it is. So. Thank you, Mr. President.
Only certain neighborhoods, though.
Only certain neighborhoods. You are right about that.
You ain't going to certain
They ain't taking that to Chestnut Hill. Oh, no. Yeah, so. And I represent Chestnut Hill. Great neighborhood. But you don't have those kinds of problems there. You have them in black and brown parts of the district, so.
Chair recognizes Councilman Dr. Anthony Phillips, then Councilman Rulando.
Thank you, Council President. I want to begin by thanking Dr. Palvic and her team for working with us to address tobacco sales in the city of Philadelphia. I just want to make sure that the new law that all of us, that I introduced, that members of the City Council supported around ensuring that there is tobacco education, where if an owner in the past, one of their clerks ended up having a tobacco sell to a minor, they would just ultimately not have any real recourse. They may be opened up again within a matter of weeks, but we're hoping that this bill requires them to provide education to their clerks to their store clerks about the importance of noticing who minors are and checking for that and making sure that that doesn't happen again. Can you talk more about the implementation process
absolutely.
going into the year?
Sure, absolutely. And, our goal is education and then regulation wherever possible. If we teach people why and how they have to do something, they're likely to do it, sir. So we are, I believe, completed developing the module for education. We want to have it available so that the store owners can have it readily available to them via, YouTube or what have you. And we are going to be enforcing the law and making sure that we keep track of who needs to get the education and getting those numbers. I believe we're trying to, after we address the rat-related issues, going to set up a meeting with your office to do the follow-up. I believe Ben Hartung and Deputy Jim Garrow might have already met with your office. So we're going to go ahead and provide you the data as we collect it about the folks that have been gone through the training and the education's been provided. And then we really want to look to see, based on those areas, do we have an impact, right? So do those places, they got a ticket, they got whatever, they went through the educational module. When we come back around on the cycle, the annual renewal cycle, did they receive additional tickets? So we're going to also keep track of that data.
Thank you. One of the things that we've been talking about is responsive government, even when it comes to our public health. when we talk about when it comes to responsive government, it's about the idea of how can the public health department create for all council offices and to be distributed to neighbors a clearly explained report on all the services that public health provides to the city of Philadelphia, also with a service level agreement of if you request this, this is the time frame for execution, especially when it comes to vector control issues.
Absolutely. That is something that we absolutely want to do and put out. So we have mini dashboards for other things that we're doing. And so when it comes to vector control services, we realize that besides having a phone number, right, it's spring. We've had a bad winter. So the rodents, the rats have been in the sewers. We've been indoors. Now all of us are coming out. And lawns are overgrown, so you have harborage, rodent harborage, and then you have the availability of food because people aren't maybe storing their trash the best way. And then we're out and about, so we're more likely to see the rats. So besides having the phone number, we also now have a web address set up so that we can, an email address so that we can also get complaints from there. And we have a database that is almost to completion, so hopefully we'll be able to put it as a dashboard so folks can see the progress.
Can you commit to working on a service level agreement, one pager?
Absolutely.
Thank you so much. And then also I'll come back to you, Dr. Harvey, but for DBHIDS, I just want a quick question. I heard the bell. How is DBHIDS has emphasized service to residents. In our conversations with DBHIDS, our office is focused on young people and rec centers as trusted spaces where children, parents, guardians, and caregivers are already there. And so therefore, how is DBHIDS thinking about rec centers as access points for family behavioral health support, including therapists? Is there a conversation being held about having family counseling, parent engagement, and caregiver support at rec centers on an ongoing basis?
I think that's a great question. Right now, we do have some of our community engagement teams that go to the rec centers, especially the ones that are with the neighborhood community action centers. If they're located in the rec centers, they provide information about the services. We have that available. They also provide information if there's a community meeting. But I think your point about can we provide behavioral health services as a touch point, as a way for people to access services, I think there's an opportunity for that. It could look anything like maybe having one of our behavioral health specialists rotate through some of these rec centers on a regular schedule, so people know that somebody's going to be there. But we really want to maximize the action centers at each of the districts as a possible place for residents to come to when they have questions about behavioral health services or they have a need. We also have it's easily accessible, and I think this is really for the community. And I know it's not for, people that live out in the far east, far northeast, but we have our behavioral health urgent care center. That's an excellent place. It's not just for, to get additional information, but it's a place to provide immediate support if people have questions about how they're feeling before it escalates into a crisis. So we're using spaces like faith-based, where churches and mosques, we're
Right.
in different spaces providing information, but I think to your point, we can be more intentional about not just providing information and resources. Is there an opportunity for us to engage differently and get a better sense for what people need so we can make the right connections?
Yes, Commissioner, and that's exactly why I was hoping you too can commit to having a public-facing one-pager or guide on all the services offered by DBHIDS.
Yes.
That could be in our schools, rec centers, and we can give to our neighbors, because if you're in a church in the 9th District, I don't know.
Right.
And I wish I can give our neighbors a document to say, if you need mental health, here's what you do. Right? And also how to go about requesting those services.
Right.
Because individuals are going to need, I know you work with a lot of agencies in the city, but individual mental health support is also important. And beyond, I know you passed out that
988.
98
Yeah.
flyer, but
Right,
that's
right.
just
yes.
a tip of the iceberg.
We also have a QR code, actually, that has all of that information. So I think we're going to try to place as many of those resources in as many places as possible, and they can just use their phone to scan, and you have a list of all of the CBH contracted providers and some of the county providers, any service that people are looking for.
Yeah,
they can
that's just
easily-
not as clear as it could be. You can provide that, but I'm just saying something more accessible, maybe a one-pager
Sure.
that talks to all the steps.
Absolutely.
That's important.
Yep,
But thanks for committing to that. We'll work on that together.
thank you.
Thank you very much, sir. Just a point of information. Commissioner Patel, I know you said the good food purchasing coordinator position has been vacant as of recently, correct? Just clarify, because my team has since 2022. So either we getting wrong, I think we probably don't have the
Yeah,
most
let
updated
me-
information.
Let me go ahead and get back to you, so,
Okay.
all right? And
Yeah.
we will, yeah,
Yeah, our records have 2022, so we
Okay.
probably have not the least the most updated information. Chair recognizes Councilman Rulandau, then Councilman Jamie Gaudier.
Good morning, Commissioners. Thank you for being here. Appreciate you so much. I want to start with two areas, one having to do with beds, treatment beds, and also then LGBTQ health and HIV health. I'm confused, and I would love some clarity. It sounds like from your testimony, DBHIDS, that you're saying overall bed capacity exceeds utilization, and that you put out, it sounds like RFPs. You got in 2024, service providers opened up beds and they were underutilized. So I wanted you to kind of talk about that a little bit. What are the barriers to that? But then we now have a situation where we're trying to expand 1,000 homeless beds and finding that space. What's the intersection here? There's many people who are trying to get a homeless bed who do have substance use disorder. Are you connecting on these two areas? What's the communication like? And did the city fund or put any resources into this expansion of the treatment beds where we could actually just use them without additional money for the homeless beds?
So the 1,000 shelter beds, we do work very closely with Office of Homeless Services because it's our outreach teams that are engaging at street level with individuals and getting them into shelters. And some of those individuals may decide they want to go into treatment, which is preferred, so we do facilitate admission into treatment as well. So there is coordination. It's actually fairly seamless coordination, whether they're going directly into a low-barrier shelter like Philly Home at Girard, or we're getting them into treatment. So now once they get into treatment, there's an opportunity to transition to Riverview. The procurement we did was to address the concerns that we didn't have sufficient substance use beds, I think in 2024 or the last hearing. And so the procurement allowed us to add additional 400 beds at 12 different sites. However, we know we have sufficient bed capacity now, but I think it's possible that due to low referrals or low utilization of financial strains, we have 5 sites closed. So we did close, but it doesn't affect the current capacity we have. We have sufficient beds to meet the needs of Philadelphians. And so we're not concerned about that.
Did the city spend money on these other treatment beds that we've now closed that are not being utilized?
So the treatment beds are funded through the Medicaid Behavioral Health Managed Care Organization within DBHIDS, which is CBH. So these are CBH-funded beds. Some of them we will fund if the individual admitted doesn't have health insurance, and we use state grants. So there are no general fund grants technically going into these beds. It's all Medicaid and state fund grants.
Now that the beds are offline, are we still paying for them? The beds that you said there's treatment beds that we are, because of an underutilization, that are no longer
We're not
necessary.
paying. If they're
You're not
closed, we're not paying now. We
Is
only
your-
pay for beds if there is a body in there.
Is your, I'm excited to hear about the centralized bed registry. Are you going to have a direct connection? OHS is finally going to have a bed registry as well. When there's a homeless bed available, they'll be able to see where it is and be able to put somebody in real time. Are your two databases going to be able to speak to each other?
That's a really good question. So there are two opportunities that we're exploring with OHS, and just like with PDPH, we're very close to OHS. We're right now looking through an opportunity that allows us to see homeless individuals that our homeless teams are engaging and putting them in a database that is HIPAA compliant that OHS also has access to, so we're not duplicating information. So that's one. The centralized bed registry, we want to pilot first with the crisis response centers. We have 5 of them, so that as they're assessing individuals, they're able to put the referrals right into the centralized bed registry, so that the receiving provider that they send the referral to gets that information very quickly, as opposed to a faxing or a call, and they can review and say, yes, I have a bed for Kenny, and she can come at this time. And so there's more visibility in terms of what beds are available, what types of beds, and where these beds are. Again, this is as good as we're able to ensure that we're writing into provider contract the need to make sure that they're updating their bed capacity and make it part of their provider agreement, because we need to ensure that they're compliant.
Yeah, and I hear you. You're also talking about increasing bed capacity, but we weren't able to fill the other beds. I'm still confused what the barriers were to the original beds, why we weren't able to fill them.
I'm going to have Donna Bailey, CBH CEO, speak a little bit more to the details.
Good. Good morning, President Johnson and members of City Council. I'm Donna Bailey. I'm the CEO of Community Behavioral Health. So I just want to explain that we don't own the beds. So when we do procurement, it's really to allow us to be able to access additional bed capacity. And as the commissioner said, Medicaid only pays if there's a person in the bed, they meet medical necessity criteria for the service, and so on. And so we did that procurement in response to concerns that there was insufficient capacity. The unintended consequence has been we are now overbedded, or we have more capacity than what's currently being utilized. That utilization is really dependent on people, being referred to care at an inpatient level. So there's no barriers to people getting that service. It really is much like on the physical health end. Sometimes, there are days when beds are not filled.
Okay, thank you. Can I ask a couple of more questions about?
Wrap it up.
I'm coming back.
I'm not giving you a hard
Thank you,
time, man.
and see you next round.
Ask that question, though.
Yes, it's not about beds anymore. I wanted to move into, there we go, I got it. Thank you. I wanted to get into a little bit of HIV and health and LGBTQ and health. So the state's health department sent a letter to Philadelphia Fight in September 2025 saying that disbursements for Ryan White Part B and special pharmaceutical benefit programs are reduced to only 25%, and it doesn't have sufficient funds to maintain the level of program activities for FY '25 and '26. This significantly impacts Ryan White eligible folks to get the assistance they need, whether that is emergency funding administered through ACO or the ability to get healthcare services. How has the reduced funding impacted the administration of services, and how do you anticipate this impacting people who are in treatment for HIV and AIDS? And also, what is the capacity of staff that are overseeing HIV health prevention and services? I'll start there.
So, as far as where we are with the HIV and HIV funds, as of right now, we are remaining steady. There was information that was received, and we ended up having to look and make programmatic cuts. One of the areas that we did originally engage in cutting was the TEACH program. I believe I'm saying that acronym correctly, but since then we have met with them and reallocated funds within our budget to go ahead and make them as whole as possible. So I believe this was an item that council member, your office had raised with us, and the group had also reached out with us, and Dr. Brady, myself, and DC Garrow met with the group, and we've been working with them to figure out how we can assist them.
Great, thank you. And then what's the capacity of staff that are overseeing HIV health prevention and services?
One more time, I apologize.
Sorry. What's the capacity of staff that are overseeing HIV health prevention and services?
So our capacity is the same as it has been.
Okay,
We're at level.
thank you. I'll come back. Thank you very much.
Member Gaudier.
Thank you, Council President. Good morning, Commissioner Raval Nelson and Commissioner Solanke. Thank you both and your teams for your partnership with my office and also the work that you do on behalf of our citizens every day. My first questions are for public health. Commissioner, in response to the Council President's earlier question about our city's recent F on air quality, you mentioned a few air quality measures that the Health Department employs for some sources of air pollution in our city. However, for the past 7 years, Philadelphia has sent 30% of its trash to be burned at the largest trash incinerator in the country, which is owned by a company called ReWorld. The ReWorld incinerator has been repeatedly cited for poor environmental practices. In fact, ReWorld was cited again last month for not inspecting radioactive waste before burning it. It is located just down I-95 in the city of Chester. The American Lung Association, who authored the recent report on our air quality, endorsed the Stop Trashing Our Air Act because, as stated in its letter of support, municipal waste incineration poses serious and well-documented risks to public health, particularly for those most vulnerable to air pollution, including children, older adults, individuals with pre-existing health conditions, and communities of color that already face a disproportionate amount of environmental burdens. In Philadelphia, in our metro area, more than 577,000 adults and 137,000 children live with asthma. And, earlier we were talking about the Canadian wildfires. We remember that impact all the way here in Philadelphia, so I don't think I have to stress to you the impact that an incinerator in Chester would have on Philadelphia. So I have to ask, what are we doing to address large-scale polluters like the ReWorld incinerator, and how is the Health Department working to ensure that our city is not contracting with industries that contribute to polluting our air and making Philadelphians sick? And then more specifically, the Parker administration opposed the Stop Trashing Our Air Act, which would ban our city from contracting with polluting incinerators. Was that opposition informed by a public health perspective? And if so, what was your participation in the Parker administration's opposition to the bill?
So, council member, I can start by saying, and I think you and your office are well aware, my background is environmental health, and specifically environmental health and policy and environmental justice. Mm-hmm. With that said, the things that we can do in terms of the incinerator and working, and when we were here for the 5-year plan, I mentioned the city of Chester has recently gotten a new health commissioner, and I've met with her once. I'm hoping to meet with her again along with the Director of Health for Delaware County to figure out the ways that we can partner and work on the items that are within our control in terms of providing them assistance. We are monitoring the air, and we can gladly share the data. As far as, because the incinerator and also the incinerator sits outside of the city of Philadelphia, all I can say is wherever possible we can partner to help, we will. And
can I pause you?
Sure.
Is our city's contracting within our control? You said we would do what was within our control to help. Is our city contracting something that's within our city's control?
The city contracting system would be, I'm sure, I know for the health department, we RFP things and pick lowest bidders and go through the procurement process, so.
But you would agree that the city of Philadelphia has control over who it contracts with.
I would say so, yes, ma'am.
Okay, so this is something within our control that we can help Chester with, yes?
One more time, I'm sorry.
So this would be one of the things in our control that we could help with. You said that we would be willing to help Chester.
Sure, I'd be willing to help.
Okay. Was the Parker administration's opposition to the bill informed by a public health perspective to your knowledge? And if so, what was your participation in that opposition? And then lastly, we've talked about, you know, the air monitors that you all put up. Earlier when the council president brought up the American Lung Association's rating on our air, you said that you would have to review it and get back to us. And also, there is a pretty well-crafted study that Delaware County did about the very harmful impact that trash incineration has on people's health. Why does it seem like the Parker administration only trusts data that the Parker administration puts out? As a doctor, do you think that we should also be taking into account reputable sources like the American Lung Association, prior studies that are credible about the impact of trash incineration? Why do we have to start from scratch on things that have been studied pretty well?
So, ma'am, I've agreed with Council President. I'll absolutely look at the studies and be happy to get back to your office.
Okay, and then can you answer the question about how the opposition to the bill was informed by any public health perspective? To your knowledge, was it?
Again, I'm going to look at everything and absolutely get back to your office.
Thank you. I'll just close by saying we have this F-Air rating. We control our contracting. We know the harmful effects of trash incineration. I'm looking to the Department of Public Health and the Parker administration in general to take these concerns seriously and do what is within our control to make sure that our city and our neighbors are healthy. Thank you so much.
Yes, ma'am.
Thank you. Member York, Member Young, O'Rourke, and the Chair of Health, Dr. Nina Ahmed.
Thank you, and good morning. Thank you all for being here. My first questions I have is for the Health Department. Just really quick, in your testimony, it says the target for non-Hispanic Black women initiating breastfeeding drops from greater than 80% in FY26 to greater than 78%. So why is this number a little bit lower? You know, when we're trying to emphasize maternal and child equity, specifically through the Joint Bank program that we have here in our city. Can you talk to us about if we are investing in you know, these health equities, why is our target lower when it comes to breastfeeding in Black women?
Sure. Give me just 1 second here. The lighting in here requires a little readers. Give me. So we have been conducting broad outreach and conducting all sorts of telelactation programs, and at the end of the day, initiation and the target for monitoring with both Black women and Latina women has been lower because of participation issues. So we're doing all of the things we can. We are also increasing our promotion. Our goal is to be greater than 80%. This past quarter, we were at 78.2%. So we are trying our darndest to get more people and do different forms of outreach where we can be considered a credible source, and then women are more likely to engage in breastfeeding.
Thank you. I just don't think we should lower the bar when it comes to this issue. I think we should set higher standards to ensure that we get to a place where there is equity in the Black maternal health system.
And we won't lower our target. Our target's going to remain where it is. We're just going to increase our efforts to meet the target, sir.
Thank you. One more question for health involving asbestos. Can you talk about what are the penalties for not following the existing protocols the department set for abatement contractors currently?
One more time, for abatement contractors
Yeah,
for
for
asbestos?
asbestos particularly, yes. Like, what are
So-
some of the penalties that could happen if you're not following the abatement plan, or if you, mislead the department about what your abatement plan is?
Sure. So we have both, they're called air pollution control inspectors as well as supervisor. Our team, folks submit their plan, and we go out to do inspections, whether it's by complaint or engaged in inspections as they are working through the course of the job. If they are not in compliance at the time of the inspection, they do get penalties. We assess and leverage those penalties. The penalties vary based on the infraction and the type of permit, but we can get you full details.
If it's a major infraction, what's the type of penalties?
So-
If it's labeled on your document as like a major infraction?
So a major infraction would mean that we would ask folks to immediately cease the work that they're doing, and then the actual penalty amount, I can get back to you on the actual dollar amount and how it's assessed.
Thank you. Mr. President, I have one more question with DBHIS, please. Thank you. My question involves the 2100 Girard Avenue in our Wellness Center. You report that there are 323 placements at Philly Home at Girard and 474 at the Riverview Placement. Can you tell us how many placements led to a stable recovery, longer-term treatment, or permanent housing, as opposed through like a short-term cycling through the program? And what are the types of services that are provided at these locations? And can you provide us with the demographics of the participants?
Great question. I can actually provide more detail after this, but I can say generally the participants receive mental health services. They receive medical services as well. There's also vocational training that's provided. There's case management training. All of the services required and necessary to get somebody on their recovery journey, so that when they're discharged, they're able to contribute to the economic life of the city. We have 151 Philly vouchers, and I believe, so OHS administers some of those, and DBHIDS administers some of those. So the idea is to identify individuals that are ready for transitioning, graduation from Riverview, who can access those vouchers. I'm sorry, I think I missed the first part of your question.
So, it was, if you could provide us with the demographics of, for the folks at the facilities. And you mentioned the One Philly voucher support program, and that is only for people that's recovering from opioid use disorder. But here the testimony says opioid. So are there other substances that people who have issues, can they get this voucher for? If I have alcoholism, am I able to get this voucher? If I have other types of substance abuse issues, or was it only strictly for opioid use?
The vouchers are funded through the opioid settlement funds, so yes, those individuals that have access to those particular vouchers will be individuals that have substance use disorder. But we're exploring other vouching and housing opportunities, including up to the Home Initiative, to kind of look through the full continuum of housing needs for individuals in Philadelphia, regardless of whether they're coming from the shelter or treatment or any of our programs.
I just think that's, I'm just questioning that because it's only for opioid use, and you look at the demographics, it affects everyone.
Yes.
But I'm asking for the demographics for a reason, because there's a rising use of substance abuse among Black men. Yeah. And I want to see if if the resources are getting there as well, or is it still going to, the certain folks? Thank you, Mr. President.
Thank you. Go ahead.
I'm sorry, I was just going to clarify, sir, regarding the fines for the asbestos permits. So our local fines can be anywhere from $300 to $500, but we also leverage, because we regulate the federal guidance and the laws, anywhere from $2,500 to $25,000. We can also make referrals to the EPA and do criminal sanctions against the folks.
Thank you, but for clarity, for a major violation, you can shut the job down.
Correct.
Thank you.
Absolutely.
Thank you.
And council member, just to be clear, individuals that are black and brown are also part of the individuals that have opioid use disorder. So it's really the full gamut of Philadelphians that have a disorder, that have opioid use disorder, that have access to those vouchers. But we do have other options for anyone else that may not have that as a primary diagnosis, so we're moving them into more permanent housing.
Just want to follow up on a line of questioning from Member Young. And so do we know the rise of substance abuse amongst African-American men by numbers?
I can get you that data, sir.
Okay, because I want to see if there's a correlation between the new movement toward the legalization of marijuana. As I was a kid, they say marijuana was a gateway drug, right? And so we also know around mass incarceration, there's a movement to legalize it. And so I want to know if there's a correlation between their legalization, right, and us saying the level of substance abuse increasing. And so that would be very, very helpful information.
Council
Yes.
President, if I could just let you know about the procurement position, I just want to, the
Yes.
food
Sure.
procurement position. So the food procurement position that I was referring to, which is within our CDIP division, that is filled and was vacated because of the person. The position that I believe Council President is referring to is a joint position between us and procurement. That has been vacant, and we are working with our new procurement commissioner to go ahead and fill that. That position is 50% with health and 50% funded through procurement, so we are working on that. So I just wanted to correct that for the record, sir.
Okay.
And we will keep an eye on that and do our darndest to get it filled.
Yep, the name of that position is the Good Food Procurement Coordinator.
Yes, sir.
Okay, because y'all know I'm vegan, so you give our young people some healthy vegetables and some foods, and if they may not want to eat any meat, they can have that option to have maybe some tofu, a little bit of seitan, seasoned properly for our young people. So, but thank you for your hard work
You're
around
welcome.
that. On all seriousness, well, I was serious, but thank you for your hard work around that issue. Councilman Nicholas O'Rourke, and we've been waiting here for our chair of health, Councilman Dr. Nina Matt, who will be next.
Thank you, Mr. President, and sorry for cutting in front of you, Dr. Ahmed. Dr. Nelson, thank you and your team for all of your work and for your responsiveness to our outreach when questions arise. Our team is super grateful for the quick engagement, much appreciated. I want to ask a few questions about your Resource Hub program.
Yes.
Excuse my voice. Especially the co-location of resources in sites like Puentes de Salud. From my understanding, this has been an invaluable program that benefits from the language access and community trust of Puentes and resource distribution by the health department. But due to contract changes, these resources are being pulled from community sites like Puentes and moved to Mayor Parker's many city halls for neighborhood community action centers. For the record, what types of resources have been provided by the Resource Hub specifically at Puentes de Salud?
Sure, absolutely. And I just, thank you for the question, Council Member. And I just wanted to clarify for the record. So the Resource Hubs are, and Deputy Commissioner Garrow is passing around double-sided information so that everybody has access to it. The Resource Hubs were a part of our COVID funding, our federal funds that we received. Those dollars are sunsetting at the end of this June. And so the funding to pay for the rent, to pay for the security, the cleaning, and all of those items at the Resource Hubs, that funding is ending. So, but we know that our communities still need us, and we know that our communities need the resources that we were providing, whether it's masks or COVID test kits or free condoms or the newest, latest, and greatest condom holders. We want to make sure that we have them accessible. So what we began doing as we realized that this funding was sunsetting. We started partnering to figure out where we could create spaces so that communities could still have access to these resources and the test kits and everything else. And one of the areas that we realized where we don't have to pay overhead, where we don't have to pay for security and cleaning and all of those other items was at the neighborhood action centers. And so we ended up partnering with the neighborhood action team. And again, Jim is passing around, I don't know if you have it yet, council member. We are passing around the information that shows the map. We are hoping to go from having 4 sites to actually 10 around the entire city. And so that there is access. I have also met with Puentes to figure out how we can address the challenges and the issues with them.
Okay. So then that's the reason why you're planning to move the services out of Puentes to a neighborhood community action center starting in July 1st, because all that funding will be sunsetting. That's the logic behind that?
Correct. But,
Okay.
and I'm sorry if I could clarify, at the same time, we're more than willing to still provide the items. We just don't have the capacity to pay for the rent and the rest of the overhead.
Okay, heard. The locus of my concern had to do with language access. And so for me, if Puentes was providing that, moving them out of Puentes would be concerning for that reason, because of language access issues and the community trust Puentes has built already, especially with our migrant neighbors. So thank you so much for this. I'll keep this to the side. You're of the opinion that the neighborhood community action centers will be able to provide the same level of language access that Puentes de Salud has offered? Is that something that we can trust?
So that is the goal, and that is
That's the goal.
something that we can absolutely make sure it's addressed.
Are there currently any staff Spanish speakers in the apparatus that could be moved to?
So we use language access, we use Language Line and other language resources within the health department. We do have Spanish-speaking staff. However, we can work to figure out the best way to address that need. I have been personally actively engaged with Puentes because
Okay.
I want to make sure that we, as a non-English speaker, English being my second language, I'm very mindful of those issues. So I want to make sure that at the end of the day, we have the best solution for the community that needs the Department of Public Health to be there for them.
That's great, and I appreciate that. Do we know right now which neighborhood community action center that folks will be directed to away from Puentes?
So, sir,
That's in here?
Yes, if you
Okay.
flip it over the flyer, there's a map. And
Got you, okay.
Yep,
One of the things that, I think I'm looking at this right, maybe I have it wrong, I think that's east of Broad Street. Is there one in the second district? Is there a neighborhood action center in the second district? Because Puentes, I think, is in the second district. And- Sorry, go ahead.
No. I apologize, I don't have the.
Not sure, okay.
Yep.
That was one of the concerns, is that the language act, Puentes, as I understand it, is in the second district. If we're moving it to a neighborhood community action center, because the funds have been sunsetted, and that's already the plan, great, but then the location does matter because of where folks are. You want to say something?
So, yes.
Yeah.
The second district action center just opened last week.
It did, okay, that's
All
great
right.
news, awesome, fabulous.
Hey,
Okay,
Thank the team, they're the ones like passing me answers, so.
okay. Thank
Yep.
you, team, for getting that squared away. That does address some of the concerns that I had. So there's no necessarily, as long as it's there and we can get some language access at that neighborhood action center, I think that'd be good, because I think all of the resources that were coming out of Puentes will be able to just be replicated in this new spot. So that's awesome. I heard the bell, want to honor the clock. Is there a second round?
We have a hard stop at 1, so I think we can get there, but ask that question, sir.
Let me ask just a few more, and I'll keep it real tight. DBHIDS, Thank you. Thank you for the work that you do every day to support some of the most vulnerable Philadelphians. Some of this may already be addressed, so if you have already gotten it on the record in your opening testimony or it's across questions that I may have missed, then just disregard it. Take what you can. Like many folks, I am concerned about the coming changes to Medicaid enrollment and funding and how that'll detrimentally affect the lives of those who rely on Medicaid for their health care. I know that we have up here 73,000. I had actually on my record 67,000 Philadelphians will lose Medicaid coverage due to the federal cuts. What proactive measures, if any, have you been taking to address the Medicaid changes? Let me just get them all on the record. Is there any collaboration with the state to prepare for the fallout of the cuts? Is there any public awareness information campaign that you're running about it? And I know that you've said that you're preparing for some of this already. I kind of wanted to get some details about what that looked like. And some are proposing a public health emergency fund or that the city step in to fund its own Medicaid subsidy program as a safety net for those who will be uninsured due to these Medicaid changes. If provided with the funding, does DBHIDS have the ability to administer such a program? And I got too many more. Let's just go with that. Yeah.
That's very good questions. And I have our in-house expert, Donna Bailey, who is the CEO of CBH, and CBH is the city's contracted managed care organization insurance that serves all Philadelphians that have Medicaid. But in answer to your first question, is there anything we're doing? Absolutely. In addition to the effort that the MDO's Office, Health and Human Services, has embarked on to contract with a consultant with deep Medicaid knowledge to help create stakeholder engagement around 4 areas, which is enrollment, financial assessment, eligibility, and I think fiscal technology solutions. In addition to that, and that work will start in May, and we're going to be looking to you to be part of some of those work groups. So we hope you'll be able to participate. However, on our end at DBHIDS and CBH, there's been a lot of work being done. So the state behavioral health managed care organizations and counties have been meeting to talk with the states to talk about what are some of our early mitigating strategies, what data should we have access to support individuals so we can make direct outreach, and what are some of our Philadelphia-specific strategies to raise awareness so that Philadelphians know what we're doing. And so Donna, who's been heading that task, will speak a little bit more to that.
Thank you, Commissioner. So, as the city's Medicaid managed care organization for behavioral health, this is obviously an issue that's of deep concern for us. We're concerned for individuals who might lose coverage, but our revenue, our capitation, is determined by enrollment. So the fewer people we have, the fewer revenue we have. We're funded 55% by the federal government, 45% by the state. So last year, we really worked to try to delay these changes. We were unsuccessful. We know they're coming. So our strategy really has been one of education and outreach. So earlier in the year, we really were focused on provider education, stakeholder education. Now we're shifting more towards member engagement. We know, or the Pennsylvania Department of Human Services is estimating that 184,000 Philadelphians are in the expansion population. Those are individuals who gained eligibility through the Affordable Care Act. They're the ones that are really going to be at risk for losing their coverage under these new policy changes. Of those, we're expecting about 74,000 to lose coverage. I think that's a low number. So we're also looking at our own data at CBH. We're estimating about closer to 90,000 individuals who are currently receiving behavioral health services to be at risk. So what are we doing? First, we understand that a lot of people don't even know they have Medicaid. They think they have Health Partners or Keystone or Geisinger or UPMC for You or United. That's Medicaid. And so that really is our talking point. If you have any of those organizations as your physical health insurance company, you're automatically enrolled with CBH for your behavioral health coverage. So we're doing a lot of public services announcements. We're out in the community. We have a member services team that's like the first line of information and resources. They have a script so that when people are calling in, they're asking those questions. We're also planning for member engagement activities across the city this summer, starting June 13th. We do have some flyers. The first one will be in partnership with Concilio. So we really want to go to those neighborhoods where we know we have a high percentage of both eligible and utilizing members, prioritizing those first. We're also working with PADHS on how they are planning on implementing this. We know that folks can get a waiver if they're considered medically fragile. The state has not issued what their definition is going to be for that. We're really encouraging for a broad definition so that as many people can be exempt as possible.
Is there going to be like a day that we're going to get the definition, or what the definition will be?
So we're expecting that CMS will give additional guidance to states in June, and hopefully shortly after that, PADHS will issue their definition to the managed care organizations.
Okay, great. I see a switch over. I have more questions, but I can wait for another round. Wait.
Chair recognizes Councilmember Dr. Nina Mann, who's the Chair of Public Health.
Thank you, Council President. It has been good to wait and be the last person because I've heard all my colleagues ask their questions, very insightful questions. Good afternoon and welcome. I just want to start by saying thank you to both these dynamic commissioners, both for Public Health and for DBH-IDS. I am grateful to all of you for your cooperation, for work in collaboration. There's nothing greater than the health of Philadelphia. Our mental, physical, and our wraparound services that keep people engaged and fully participant in our society. So I thank you both for that. Now for the question. But first to the public health. We had this conversation already in our meeting we had around the projected timeline for the health centers in the Northeast, the additional health centers. There's a 9-month to a year wait for people to be seen. We are already facing so much stress from the federal government that is undermining our health in the country and, of course, here in our city. We need to have every available resource to support our communities to have health care access. You had informed me that all the legal barriers were resolved, a lot of things were resolved, and now we're getting ready to hit the ground. And there's a 2029 date for the Frankfurt one, and there's a 2030 date for the Friends Center. This is unacceptable to have so much time. Projects of this nature, of this scale, shouldn't take so long. Much bigger budgets take maybe 3 or 4 years. For this size, it's unacceptable. So I need to know what exactly is the barrier to expediting this in a timely fashion so our constituents in this part of town have access to health care. We were able to, in 2 weeks, get 95 done. We know we have the capacity to do this. We need to have the will to do this. So I really want you to clearly articulate in a public setting for our public consumption, what is the barrier? Why is it 3 and 4 years that'll take now that you have resolved lawsuits and everything else? What is the real reason for taking so long? Because it should not.
Sure, Council Member. So let me start by saying this, right? Pouring concrete to build a road can't be compared with building 2 health centers, specifically health centers which require a multifaceted set of exam rooms, mammogram, all sorts of services. So it's not, yes, we can absolutely pour concrete. I'm not a civil engineer to patch a roadway. It's not the same. And cannot and should not be compared to the building of health centers. So where we are, we have 2 sites. We have the Frankfurt Transportation Center, and that is going to be a multi-use health center, a residence, as well as a grocery store. That is going through the process steps of getting the core and shell built and everything. And remember, this is a health center. We all know what recently happened with the collapse. I don't want to move anything faster than it needs to be. We need to make sure that the health center and the site is safe. So that site is on its trajectory. We are working through the letter of intent. We are working through they have new market tax credits. We're working through all of that to get that through design. Both sites, we have conceptual design drawings for. Now, the way that construction works, our CPO, our DMD for capital projects has explained and taught me, is that we have phases. Construction occurs in phases. So we have our conceptual design, then we have our architectural drawings and our blueprints and everything so that it's sound, especially now that for the Friends site, the litigation has ended. Once those drawings are finalized, approved, verified, we have the permitting for that. That is when the process occurs for the building of the core and the shell, okay? That takes its own time. Once the core and shell is built, then we go ahead and do the fit out. The fit out is the phase of the construction where we decide about the exam rooms, the items that are needed, and we get the equipment and all of that. The FTC site is, because of the multi-developmental uses for the FTC site, it is a smaller building compared to the site at the Friends Hospital. The FTC site is on its own trajectory. We're working on the LOI, the letter of intent, and the lease documents. For the Friends site, we are in the final phases of selecting the architect and the designer that will take our conceptual design and go ahead and turn it into drawings so that we can then move towards the permitting and the construction aspect. The building itself that was there on site, that was the Lawnside building where the health center is going, that has been demolished. So we are moving on the most appropriate and the safest trajectory that we possibly can. Again, I want to be very careful and cautious. Pouring concrete for a roadway is not the same. That, we want to be cautious on how we build up our health centers so that they can last us for upwards of 80 years.
Thank you for that. So you might not know, I actually have background in development. I do know what you just described is a process, but you did not describe time involved. So time is money for contractors to put these things down. So what I'm finding is sort of bureaucratic speak is what I heard from you. Not your fault, because you might not know how this works. You were told something by the capital budget people probably. All I'll tell you is it is not about pouring concrete to do a street. There is no reason where we are today for this to take as long as has been told to you. And I will follow up with you, with whoever gave you that information, step by step, to tell you, getting all the financing together, getting the actual contractor in place. It should not take so much time if we are intent and if we are intentional about it. So we're going to have a conversation after this, which I will then publicly share with everyone to say what exactly is the hold up of doing this faster, because this has taken years to even get here. So I don't accept that answer, and I will actually look to see details, and this is going to be a callback, details on the actual construction project to say why is it taking so long, because this scale of project, just with the money involved, should not take this long. Much bigger projects take shorter time than this. And to the safety issue, the garage issue was a materials issue, and we're going to hear about that. This is not a materials process. Material science was involved in the garage collapse, not in this one. This is not going to be using those kinds of materials, but yes, safety is paramount, and we have the best building industry here that can guarantee that. So I do not take this answer, and I need to have a much more specific, detailed, that I can share with my constituents about why these things are taking so long, step by step, including financing all the way to the contractor. So we'll get back to that, so thank you.
I welcome the conversation, council member, and I just want to make sure that I put on the record that all of us are working together. We want the safest and the best health centers. Again, And I know, based on what you just said, you have expertise in this, and I appreciate that, and I look forward to us meeting with our colleagues with DPP and CPO, because they are extremely great partners in this, and we can absolutely go through the process, but where we are right now is we have conceptual designs, and we are working to get the firms selected to take us through construction and then take us through the process. We want to make sure that we have the safest and the best sites.
Thank you. We will circle back on that.
Absolutely.
I'll just want to, because of my limited time, want to shift to DBH IDS. I wanted to get your perspective on the partnership you have with the Department of Human Services. How engaged are you? Because in the last budget hearing, we were alarmed to hear there was not enough DBH IDS presence in this process of child welfare. And what I mean by that is when the investigators are going out responding to a complaint, their load in terms of how many cases they're processing, what support the social worker is getting there, and similarly, what is your engagement with COAs who are actually executing on following up on that investigation? I want the entire wraparound, perspective you have, because I love the diagram you gave us in your material about a well-rounded, comprehensive kind of approach. And if that were the case, we would not have as many issues with DBH IDS, I believe, if we really did have a full partnership with full oversight from DBH IDS.
Thank you for that question. It's gonna be a two-part question. I will tee up, and then I'll punt to Donna Bailey from CBH to talk a little bit about how CBH not only partners, but we embed care managers in family court. We have care manager stations at DHS, and they've been there for over 20 years. We have care managers in all of the spaces where children who are in child welfare care are able to access behavioral health directly. So we may not be in the CUAs, but these CUAs are behavioral health providers, and so they should be able to do an assessment and determine what is right for that child, because that's literally what they're being paid for. And that was one of the reasons that DHS contracted with behavioral health service providers to ensure that there's an interdigitation, so you will, of social welfare and behavioral health.
I want to interrupt you before you go forward. Apologies, but the fact that the CUAs have no direct oversight from you in their behavioral health. They're just contracted out because that's where we're having a lot of the breakdown. Mm-hmm. And so I wanted to know how much oversight do you have of this entire process of the child welfare system? Just saying that we have this there and we gave this out to that, it doesn't matter because we're just looking at what is the outcome. And I am seeing there's a lack of engagement from DBH IDS or type resources, even though on paper that is happening. So there's a lot of things on paper, boxes checked and things done, had a virtual meeting here and there. I want our children to be able to be impacted by the care you're giving, the wraparound services. I have not seen that yet.
So a lot of the CUA providers are not CBH providers or DBH IDS providers, but they provide behavioral health services. And that for us is actually a good indicator of ensuring that all of the children and families that are coming through these agencies have the assessment, a behavioral health assessment, a child welfare assessment, and they're able to make a determination about what the family and that child needs. But we, in DBH IDS, as a county, we don't pay for these services.
So you have no oversight to check the quality of this, correct?
That is correct. We
So
do not oversee the CUAs.
We need to fix this because that is where the breakdown is happening. You can see that they hired a behavioral health expert to be in that COA. How well are they actually executing? What is the outcome? So if we as a city, where we have two agencies, public health and mental health, is not able to give oversight to make sure child welfare is working, that's a problem. So we need to all come together, whether it's legislatively or programmatically, figure out why there is no clear oversight of any behavioral work that is going on because that is COA money is a contract that comes out of our money. So this is all tax dollars. So to just say that we said, oh, they have behavioral health, that's enough, that is not enough. So we have to figure out how you have full agency over accountability in these COAs, because this whole system was set up in response to a terrible death of Daniel Lynn. And here we still have no accountability of exactly how these processes and services are being given to our most vulnerable in our city. So we have to have another callback or some questions answered about this is not acceptable. This is not acceptable, the state we are in now, because we are having so many problems continuously, even though we have given so many things. So you might have some ideas, we'll have some ideas, but thank you. I know the bell rang. I have some more questions lined up, but we'll have a second round.
So we will be breaking shortly. I will check with our council president relative to additional time after the break, although we do have another department after the break. And so if possible, I'm going to move beyond our public health chair. We thank you, Dr. Ahmad, for your questions so that we could recognize the additional members who are in the queue before break. Okay?
So we may or may not get a chance to call back.
I'll definitely, I
Okay.
will definitely get the answer and then circle back to you.
I have
Okay,
just
but
very short questions.
I wanted to make sure you had ample time as our chair of public health. Okay. All right. The chair now recognizes Council Member Landau. Really quickly before recognizing, Councilmember Landau. I wanted to recognize the Coalition of Culturally Competent Providers as they start their citywide Mental Health Awareness Month events and activities. They will start today at 3 p.m. at 69th Street, and they'll visit also Fern Rock Station, Frankfurt Station, and Suburban Station for their final event. And this is in partnership with SEPTA, and they have invited DBH, IDS, CBH, PICO, and a host of community providers and organizations to provide behavioral health resources throughout the city at our major transportation stations and hubs. So I just wanted to recognize that work and also that partnership. I will now recognize Councilmember Landau and then Councilmember Gaudier.
Thank you. I will be as quick as possible. I know this can be a fast round. The state has an affordable insurance marketplace that opens for enrollment yearly with a special enrollment period for unplanned circumstances, like losing a job or recently released from incarceration. Do we have any protections in place for folks who lose their Medicaid or need to sign up for health insurance on a similar marketplace?
So what I can tell you is that the county pays for behavioral health services for the uninsured, and to my knowledge right now, that would be the only protection. For other folks, the marketplace is available, but we also know that those subsidies have been scaled back as well.
I'm looking for tech solutions for us to make sure that we capture as many people as possible. On your website, it says that health counselors at health centers could assist with finding insurance, but I've heard from constituents who are calling our office that making an appointment is difficult. The wait is long and the closest date is usually months away. Is there a website like Penny where they can browse their options? Do we know who will be cut off so we can proactively, and do we know who's going to be cut off? Do we have an idea? The tech in the city of Philadelphia is not where it needs to be. I feel like we should know more about who these folks are who are getting cut off than we do. And do we know who they are, and can we proactively reach out to them?
So there's also Benephilly that folks can reach out to. We do know that the county assistance offices, there's challenges oftentimes with getting through on the phone. And so we're telling folks to physically go to the office. and you are asking, do we know who these people are who are potentially going to lose coverage? Yes. So CBH has looked at our data to identify the folks who fall into the expansion category, and of those, the subset who have used behavioral health services at some point. We are now stratifying that data additionally to understand who is their physical health insurer, who was the last behavioral health provider that they saw, all towards giving those providers their list of people so that they can engage more directly with them. So that data and analytic work is happening right now.
That is great.
And one other, council member, is one other option to help people maintain their insurance is the state is encouraging what they're calling community partners to help individuals in different spaces, at school, faith spaces, community centers, provider agencies, community action centers, to help people enroll and re-enroll, since we have a lot of people, 73,000 individuals who may need to have more frequent redeterminations every 6 months. So if we expand the places and the spaces people can go to for their re-enrollment, I think it's going to make a significant difference in terms of reducing the churn.
Thank you so much for what you're doing. Last question is, given the federal attacks on gender-affirming care, has the health department taken any action to protect these services for trans and gender nonconforming folks in our community, especially young people?
We have continued and will continue to provide the care that we have been.
Thank you very much.
You're welcome.
Thank you. Thank you very much, Councilmember Landau. The chair now recognizes Councilmember Gaudier.
Thank you. My questions are for DBH about our community mobile crisis response teams and the Philadelphia Crisis Line. How does the data for outcomes of dispatches to CMCRT compare now to this time last year? How many calls have ended in voluntary hospitalization so far in 2026? And how does that compare to last year? At last year's hearing, I don't think this data was available for us. And then how many calls have been transferred from 911 to the 988 line as of February this year compared to February of 2025, which we have as 4,288. And then lastly, at last year's hearing, we heard that you were expanding 988 to meet demand and that we were getting 6,000 calls a month. What are those numbers this year, and are we currently meeting demand with our current staffing levels?
All great questions, and if I forget all of them, I will ask again. So to start with, I think we began with the call volume for 988. So the call volume went up by 24%, and that is 31,692 calls. And of the percentage of those, 83% of those calls were resolved by phone, which is what we expect, which is great. But 15% of those calls resulted in a mobile crisis dispatch. I think you also asked how many calls were transferred from 911 to?
Yes, how many dispatches of the CMCRT teams, and also how many calls have been transferred from 911 to 988?
I can get the data for the 911 to 988 dispatches, and I have the data here monthly, so I'm going to have to tabulate that before the end of this hearing to give you a number. But the average dispatch per month for all providers hovers around between 500 and 600 dispatches per month. And I can give you the comparison too. From 2024 to 2026, there was a 3% increase in mobile dispatches from 2024 to 2026.
3%, okay.
Not a huge one.
Okay, and how are our staffing and capacity levels? Do we have the staff necessary to manage the PCL line? And do we have the capacity with our mobile crisis teams to meet demands?
In all honesty, we are actively engaging with OHR to support us in increasing our ability to bring on qualified staff for PCL. The process right now can be fairly lengthy, takes a little bit of time, and because we have a need, we're looking for about, how many are we looking for? About six more staff. So we have a meeting coming up to say, is there a way they can be a little bit more flexible? Because we're 24/7 and we need clinicians. So we can be more intentional about who we're targeting, who can support. From the mobile crisis side, or the provider end, we've actually been good. In spite of one provider that we've been challenged with.
Yes.
And we are sticking with them. We're still in there to win it.
Thank you.
And we haven't seen any, I mean, think about it, we haven't seen any significant increases in response time because of some of these challenges. It's actually gone down. So we are doing something great. And so once we get the provider stabilized, I have no doubt that this time next year, we're going to get a 30 minutes dispatch to response time.
Thank you.
That would be great. If you could follow up with data promised, that
Yes,
would
the
be
911 to
fantastic.
988 calls, yes.
Thank you.
Excellent.
Thank you, Madam
Oh,
Chair.
we have
Thank
the
you.
number, we have the number.
Very quickly, please.
1,632 calls from 911 to 988.
Thank you. And is that an increase, just remind me?
That was calendar year 25, so I'm going to have to see the CY 24. But we'll get that to you.
Please
Okay.
follow up.
Thank you. Thank you very much. The chair now recognizes Councilmember Young.
I don't want to explain why.
Thank you. I mean, my question is along the same lines around 988. It says that 83% of 988 calls were resolved in 2025. Like, how are you determining that those calls were actually resolved rather than like simply closed out without any escalation? Is there follow-up data that exists on repeat callers or later emergency utilization? And that, I'm just referencing our own system. We have 311 that just says things are resolved when they are not.
Yeah.
And so just trying to get a sense of what, how this system works, and is this 83% accurate, and what is the definition of resolved, essentially?
What is the definition of?
Like resolved.
Resolved, right.
Yeah.
So that's a great question. So the 83% of the calls that are resolved means that they didn't have to go to a crisis response center, we didn't have to send a mobile team out, we didn't have to activate any emergency services. The resolution could be that person was stabilized in the moment, but we also have a 72-hour follow-up process in place where we're calling in to check in. It depends on the level of intensity of need that person is experiencing, so we can call them every day or every so often hours, or maybe kind of space that out. So we do follow up also to make sure they're connected to services. So we do, for the most part, if we looked at the trajectory, we could find out where people are going post that call. So we feel fairly confident that if we're saying that the call is resolved, that person is stable, they're connected, we've followed up, and if anything bubbles up, they can always call back, and we do have some repeat callers.
Could you give us the data on
Sure.
that? Thank you. Thank you, Madam
Can you
Chair.
be more specific on the
So
data that you want?
on the number of follow-up calls or repeat callers
Okay.
or later emergency utilization.
Oh, sure.
Thank you.
Thank you. Thank you very much, Councilmember Young. The chair now recognizes Councilmember O'Rourke.
Thank you, Madam Chair. I wanted to get a few more of the questions that I had on the record, and I'll try to get them real tight. So I'm just going to say them, and then hopefully you can respond to that, if that's okay. If 67,000 Philadelphians lose Medicaid coverage, another major concern is lack of Medicaid reimbursements for providers. I wanted to have you hear some forward thinking about this. How do you plan to protect the agencies who provide services, including all services on the crisis continuum, from closing due to insolvency? Your economic impact report estimates that 810, and I apologize if this was already spoken to, that 810 community behavioral health jobs will be lost due to the cuts that we talked about earlier. How do you anticipate the shrinking of the Medicaid rolls will impact community mental health in the city? And two more. In 2025, how many people moved through Wellness Court? Of those, how many were connected to ongoing services? You may have already asked that question. I apologize if you already answered it. And how do you categorize and measure outcomes for people who participate in Wellness Court? Thank you.
Thank you. For the first two questions related to the individuals that are losing MA, the 67,000, and how we plan to support those agencies, I'll have Donna say a little bit about some of the mitigating strategies we have, and then I'll speak to the county side.
Thank you.
Sure, thank you. So, I mean, really our focus is on ensuring that individuals know about the changes that are coming so they can stay covered. I think the issue about agency solvency is a bit more complicated. We know that coming out of COVID, there were providers who closed lines of business or in some cases closed their agencies altogether. Sadly, I think additional agencies are going to close. Our rates are going to be capped. Our rates are going to diminish, and we're going to have to make hard decisions, I think, about what the network looks like and who and how much we're able to contract for. In terms of agencies, we are having conversations with them about what does cooperation look like among providers. They tend to compete, and what we're suggesting is looking at what one agency might do really well and disinvesting of those services that they might not do well in and partnering with another agency. So we can't broker those conversations, but we know that they are happening out there. Right now, today, we feel like we have sufficient capacity across all levels of care. I think if those numbers increase to the extent that we think they might, then there will be serious concerns about access in Philadelphia.
So what I hear you saying is that you're clear about your priority, which is making sure that individuals have the care that they need. To the degree that you can address the financial insolvency, what's going to come with this, you're trying to encourage cooperation amongst groups to kind of move away from a competitive model to one about all of us trying to provide.
Correct.
Say that word again.
Co-opetition.
Co-opetition.
Managing Director Crystal Yates.
Well said. Stolen. I'll use that now going forward. Co-opetition.
Co-opetition.
And also, you currently feel like you're staffed up enough to be able to address what concerns are, but if you feel like if there are deeper cuts or what have you, then you will have some concerns around the state of mental health in the city. Perfect. Thank you so much for those answers. Did you get a chance to walk me through the wellness court piece?
I'm still waiting for the data. We don't have it readily available, but
Okay.
we'll be happy to share it as soon as we get it.
Looking forward to that being shared. Yes, indeed.
Thank you. Thank you very much, Councilmember O'Rourke. I'd like to reserve the last 1 minute for Councilmember Dr. Nina Ahmad. So if you could just please quickly, 15 seconds. Okay, well, thank you very much. Please get back to Councilmember O'Rourke. I will now recognize Councilmember Dr. Nina Ahmad for 1 minute.
Thank you, Madam Chair. Quick question about measles, and as we know, 95% vaccination rate is needed for herd immunity for measles. Can you speak to what is happening in Philadelphia? Because we were doing very well, and I just wanted to know where we are now given what the federal government has done. And a second question, very quickly, is about maternal health and what things have been changed outside of the Joy Bank that we are doing to really reduce maternal mortality.
So as far as the Joy Bank is concerned, we
Please,
are...
I apologize for the interruption. 30 seconds, please.
Absolutely. As far as the Joy Bank is concerned, we are continuing that pilot, and we're in the evaluation phase, so we are continuing to work on that. And we can get you some additional data for maternal mortality. As far as your question about vaccinations, so we are in a very good place in terms of, we know that the MMR vaccine, which is a measles vaccine, is given at children and when folks are children. So we are monitoring that through our school district and childhood immunization program. And those vaccines are not given to adults unless there's some sort of an issue and there's a case and we need to verify titers and everything. So we are in a good place with those vaccines.
Thank you. Thank you very much. Thank you so much, Councilmember Ahmad, our Chair of Public Health. We appreciate all that you do on our behalf. This committee will now stand in recess until 2 p.m. We thank you all so much for testifying. Have a great day.
Thank you.